I want to introduce you to Bruce. So this is Bruce, typical action man, gets out there, gets on with the job, constantly getting injured, doesn't listen to his therapist, rests up for a couple of days, gets out there, re-injures himself. So the first accident he had, he severely broke his ankle. He had to have it pinned, as you can see. His parachute didn't open when I threw him off the balcony. And this is a long time ago because we've known each other for years. Anyway, Bruce, unfortunately, tends to just rest up a couple of days, gets back out there, re-injures himself, and over the years, he tends to sort of injure himself quite a lot, but he doesn't listen to anybody. So I'm doing this video because I think it's really important that he actually learns what he needs to do to properly heal himself, to make those areas of injury nice and strong. So a little bit of in-depth information is not a bad thing. So this video, Bruce, is for you. We're going to learn about tissue healing. So I'm going to explain to Bruce a little bit about what tissue healing is. So it's really important that he has some better understanding to help improve the recovery rate for his injury. So tissue healing is the body's replacement of destroyed tissue by living tissue. And there are two processes in this, two components. One is regeneration and the other is repair. Now different parts of the body will either regenerate new tissues from the same tissue, or they'll repair, like putting a sticking plaster over. This is the process we're going to be talking about more today. So with repair, it's the replacement of damaged tissue with granulation tissue, which then becomes the scar tissue you're probably familiar with. So depending on the site of the injury, the repair or regeneration will take place, and the process and the length of time may be different. So with a ligament injury, which would be regeneration, may take longer than a muscle repair. So it's important to know the difference when we're actually treating the injury. And also each client is an individual, and we need to look very closely at how they're actually responding to the help and the treatment and the activity and the exercise that we're giving them. So very individual process, and we need to work out a programme when we can work out exactly what's going on with Bruce. Now there are 4 stages to tissue healing. There's the bleeding stage, inflammation, proliferation and remodelling. Now all these stages can overlap, so they don't actually run from one to another. And particularly inflammation and proliferation, they'll run alongside each other and possibly even going to the bleeding phase. So it's really important that we keep an eye on exactly where the repair is in this process, because we may need to sort of back it off a bit, we may need to bring it forward a little bit, depending on what Bruce is able to do. So now I'm going to talk to Bruce about the first stage of tissue healing, which is the bleeding phase. It can last for up to 4 to 8 hours, but it takes place immediately within the first minute to a few seconds. It's a chemical reaction, and the first part of this chemical reaction is hemostasis, which is designed to slow down and stop bleeding around the primary injury site. Now this causes a local vasoconstriction, which is the constricting of muscles around the injury site, and then this prevents oxygen to the area, which is called hypoxia. And following hypoxia, you get necrosis, which is the dying of the cells around the area. So this immediately causes a histamine release. Now with histamine, it causes a vasodilation of the cells around the area, and this then makes them more porous, and it allows the flowing of important factors to help clot and secure the area, and also for the rubbish around the area to be taken out, but we're going to talk about that a little bit later. So the walls of the blood cells become more porous, and one of the things that comes through those blood cells is a protein-rich fluid called exudate. Now exudate is able to pass through, and it's carrying the clotting factors, which causes platelet activation. So the damaged blood vessels send out signals to the platelets, which are tiny, tiny little blood cells, and they rush into the damaged site and they form a plug, a clot. Now, part of this process involves three important players. And these are the guys that come in and secure the site, okay, and get it ready for the next phase. So they're the first responders. They're fibrinogen, thrombin, and fibrin. Now, fibrinogen is normally a soluble fluid, and when thrombin activates with fibrinogen, you get fibrin. Now, fibrin causes a platelet plug, and it's like a mesh over the area. So it's securing the site, ready for the next guys to come in and start clearing up. So clotting also obstructs lymphatic fluid drainage and aids in localizing the area, causing swelling. So this takes us on to the next phase. Phase 2 of the tissue healing process is inflammation. And it takes 2 to 3 days. It gradually resolves in 2 to 3 weeks. It's normal and it's necessary, and that's really important to realise. So some people will try and inhibit the process with the anti-inflammatories, and it's really not a good idea because it just slows down the process of repair. It's an important time for us as therapists to assist in the healing process, to calm it down, but keep it moving within a tolerable range. This is really, really important at this phase, especially for guys like Bruce, who have probably been told just to rest it up, stop it moving, but actually we just need to move it within a tolerable range. So inflammation contains the injury site and allows healing to take place. Now I'm going to introduce you to another player in this process, okay, and it's called a macrophage. So macrophages, during inflammation, the body attempts to clean up the area, to clean up the injury site by removing microorganisms, foreign cells, dead and dying cells, and the macrophage come in and they seek out and destroy pathogens. So that's anything that shouldn't be there. So it removes debris from the area, from the injury site. So the histamine release we talked about before in the bleeding phase then allows the passing, by making the blood vessels more porous, it allows the macrophage, which is a type of white blood cell, to pass through, remove pathogens from the infected area, secure the area, it's ready, cleaned up, and it's ready for the next phase. So phase 3, proliferation. It has a rapid onset of 24 to 48 hours, and it can peak in about 2 to 3 weeks, and it runs alongside the inflammation phase and the back end of the bleeding phase. So like I said before, they all tend to merge together a little bit, and proliferation and inflammation can run alongside each other. I'm going to introduce you to 2 more players. We have fibroplasia and we have angiogenesis. So they are co-dependent processes. It's really important that they work together to successfully form an evolving cellular matrix and granulation tissue to the repair. Okay. So these fibroblasts come in and they lay down collagen, type 3 collagen, over the area. Now this is where Bruce normally goes wrong when he's had injuries before, because type 3 collagen isn't that strong. It's like a scaffolding before the builders come in. And with type 3 collagen, you're likely to re-tear the area or re-damage the area if you start working on it too much. So as I said before, some movement is necessary, and this is where we have to gauge how much, because some movement is going to help the fibroblasts lay down the type 3 collagen in the right direction, okay? Otherwise, they're just shooting this collagen all over the place, and you're going to get quite a messy sort of securing of the area. So if we can get Bruce to do some movement, this is really important, but without loading it too much. So the second component of the proliferation phase is angiogenesis. And this is the formation of new blood cells and greater flow of blood to the wound. So capillaries in the injured area bud and grow towards the repair area. And it re-establishes blood flow, providing oxygen and at the same time removing metabolic waste. So Oxygen is critical in collagen production. So we have movement, really important for increasing blood flow, for laying down the type 3 collagen in the correct way by the fibroblasts, and the scaffolding is in place and we're ready for the builders. So Bruce, this is the remodelling phase, phase 4. It's the final phase and can take from 3 weeks to a year depending on the injury. And you know this, yeah, from past experience, so we're going to work at this, Bruce. The fibrous matrix laid down by the fibroblasts in the proliferation stage begins to change. There's a decrease in fibroblastic activity, a decrease in water content, and a decrease in blood flow. So resumption of normal cell activity in the area begins to happen. And movement here is key, as we said before, increases blood flow and helps the collagen lay down in the right direction. So this is important because at this stage, the type 3 collagen, which was weak and just acted as scaffolding, changes to type 1. Now type 1 is your bricks and mortar. And the builders come in to complete the job, if you want. Type 1 collagen is strong, and this is what develops into the scar tissue. So we need to load the injury area in this phase. But the amount of loading depends on the injury, depends on what Bruce can tolerate, and whether or not too much is going to re-injure it or not. But we do need to move. So we could start with some passive gentle movement, mobility, got a resistance band, and gentle isometric contractions, gradually building and loading the area as the strength comes back and as the collagen is laid down and as it begins to turn into scar tissue. So whatever Bruce can tolerate without re-injuring. So Bruce, listen to your therapist, don't run before you can walk, and build tolerance to aid your recovery. Thank you.